Dr. Manson, pleasure to meet you.
Pleasure to be here.
Thank you. So we start out really simple. Just tell me a little bit about yourself, if you want, when you were born, where you're from, your family, and then we'll get into the deeper stuff with plastic surgery, just a little identifying information.
So I was born in Kansas City, Missouri, December 28th, 1943. My father was an FBI agent. My mother was a homemaker. My great-grandparents had come over here from Sweden as immigrants in the mid part of the 19th century. My great-grandfather worked on the Transcontinental Railroad, and they lived in Chicago, which many Scandinavians did because it was cooler and they liked it there, or Minnesota's even better, cooler. So they raised children, and one of them was my father, and he married my mother, and they moved to Kansas City.
Okay. And your father's name was?
Nellis. It's a very unusual name, Nellis. His second name was Emmanuel, which is a biblical name.
Okay. How many children do you have?
I have two.
And grandchildren?
And 3 grandchildren. My 2 children are my son Ted, who's an orthopedic surgeon at shock trauma, and now partially in one of their private practice operations for the University of Maryland. He's an orthopedist.
Okay.
My daughter's a human resources specialist for Wyndham Hotels and lives in New York.
Okay. In the city?
Yeah.
Okay. So my last question was, how did you meet your wife?
So I was a medical student, and she was an undergraduate student at Northwestern, and I was social chairman of the fraternity. We were both pinned to other people, and I needed a date for a ride, and that was it.
And the rest is history.
Yeah.
Great. Tell me how you got into plastic surgery.
So I wanted to be a cardiac surgeon, and I didn't get the NIH, which is the key to a successful leadership position in cardiac surgery. So there was an extremely influential and charismatic plastic surgeon named Dr. Wolfert in Boston, who just charmed everybody. And he let you do cases, he would help you through anything. He trained here. So I said I thought I'd do plastic surgery. So I applied for a program. He said I was going to go to Cornell. He didn't like that idea. When he heard about it, he called me up and called me in and said, you need to go to Hopkins. I said, I can't get in there at Wolfert, I never get in there. He talked like a mafioso. I said, well, let me see what I can do. I think I can make a couple phone calls for you. So he made the phone calls, and I went down there for an interview. So when I went down for an interview, I took my wife and my 2 kids. We didn't have any money. They stayed in the car. And I went up to have this interview, and the chief wasn't there. So I talked to this nice guy, Jim Ryan. Who
Chief
was
resident?
the chief of the service,
okay.
Jack Hoops, wasn't there. So I thought, man, this is a waste of time. So I talked to Jim Ryan, who usually these interviews, they kind of grill you and ask you a bunch of penetrating questions, hoping you'll make a mistake and tell them who you really are, or something they need to figure out that you're not a good candidate. So Jim said, he spent the whole time talking about what a great place Baltimore was to live. So I went downstairs and I said to my wife, this is a total waste of time. I'll never get in here.
And you did.
Yeah.
So it was a 2-year program back then, right?
It was, if you were board certified in general surgery,
Okay.
which I was. They had just started a combined program where you went back and forth between surgery and plastic surgery. And to make a long story short, the first fellow who did it completed that program. The next 2 were Lee Dillon and Pat Maxwell. two of the world's great plastic surgeons who decided once they had finished the general surgery part of the program and taken a year of plastic surgery, they didn't want to go back into general surgery, so they did a year at shock trauma.
Okay. Interesting.
Well, then Jack Hoop said, well, we don't have any people to run shock trauma, so I think we'll just give it up, which was a great experience, you know. So I said, I think I can cover Hopkins and shock trauma. So in 1978, January 1st, I started covering, and I was just going to cover it for 6 months because I was headed for private practice in aesthetic surgery. I don't know why they ever picked me. And I walked out of there 30 years later.
Wow, wow. Well, we've both been around long enough, and I know you've seen momentous changes and paradigm shifts. I'd like you just to talk about that. Plastic surgery's changed a lot from the mid-'70s when we were doing BK flaps and reconstruction with local tissue transfers.
Yeah, we had a groin flap and a delta pectoral.
Yeah.
You know, and Pat Maxwell, who's one of the geniuses in plastic surgery, learned mycutaneous flaps from John McCraw before there were any books. So he came back, and he was my junior resident. So, you know, I'd ask him how to do a case because he'd been doing little rotations in plastic surgery for several years. So I'd ask him how to do a case, and he would come over and do something miraculous that I had never seen or heard of.
Wow.
And in fact, I have a couple of patients he did when he wrote up his free flap series, which had 12 patients. The first free flaps done, he went out and trained with Harry Bunke. I mean, this is just the kind of guy he was, just an innovator. Hey, two of those patients were my patients, you know, that he came and, you know, I had no idea what a free flap was. I thought it meant you didn't bill.
Yeah. And you didn't know it would take that long.
Yeah, so mycutaneous flaps, I mean, transformed plastic surgery, free tissue transfer, you know, anatomical ways of doing cosmetic surgery, breast reconstruction. You know, I remember when Carl Hartramp came here, he was doing an abdominoplasty, and they used to do it, and this is kind of crazy, but they used to do it by making an incision. They put a pattern on the abdomen. You remember this?
Yes.
They put a pattern on the abdomen. They didn't measure anything. They just assumed they could get this segment out. They made the incision. He undermined it to the midline and looked at it. He said, this thing is still alive, only off its midline perforators. And there came abdominal breast reconstruction. You know, it was a totally serendipitous thing.
I'm assuming now, that I don't do any breast reconstruction, I haven't done it for years, that the tram flap is now passe. That
Well, it's a free tissue transfer, if it's anything.
Yeah.
But implants are so popular, and the technology has improved so much that, you know, a lot of people would choose to have an implant because it's so straightforward and the recovery is much less.
The implant itself, yeah, right. Right. Well, the wheels sometimes go full circle.
You know, the controversy about implants comes up every 10 years, you know.
Yes. I know, we're going to go through another cycle.
Rediscovering the wheel.
Yes, exactly.
The wheel is round. Let's get the lawyers involved again.
Yeah, see how much money can be made.
Yeah, exactly.
No, we're going to go through that cycle with the textured implants.
Yeah.
And there's already stuff
Yeah, it's
on
like,
it.
you know, you're on a roller coaster, they slap the bar down, you say, what'd I do this for?
Yeah, yeah. Well, Hopkins is very innovative in a couple things, and craniofacial.
Yes.
I don't think, are you doing transgender stuff up here anymore?
They do a lot.
Okay.
You know, they did a lot when Edgerton was here, and Edgerton had a lot of psychiatric backup for that. And in fact,
Norman Knorr,
the person who recruited him to Virginia, who was dean, put that all on the map. Subsequently, the psychiatrists here decided that psychotherapy was as effective as surgery. So it's now come full cycle, and the patients want surgery. and they want a variety of choices. You know, it's just like you go to the supermarket, you have a variety of things.
Right.
You know, you don't just want somebody to tell you to do one thing. So it's back and it's very busy, very popular.
Interesting, because
Yeah.
I knew that there was a controversy
And
for a
the
period of time.
administration is supporting it because it fits in with all their, you know, current
Agenda.
agendas. Yeah.
What about craniofacial?
So craniofacial is still very strong. We have always been a leader in facial injury management and in facial reconstruction for skin cancer, complex, you know, types of reconstruction. Eddie Rodriguez, who's the chair at NYU now, replacing Joe McCarthy, put that all on the map with combinations of free tissue transfer done in aesthetic units, and then you get your own skin and migrate it over the free tissue transfer. They look wonderful.
Yeah. Now,
I mean, it's revolutionary.
has Hopkins done a free face transplant?
Yes.
Yes.
Eddie did one.
Okay.
And,
Were you involved in that at all?
you know, just watching.
I know. What was that like?
He insisted I come over there and watch, you know, and I'm like a sixth spare tire. You know, those guys were up for 40 hours. That was a beautifully done case. Interestingly, he's now got renal failure from his transplant medications, so he's going to have a kidney transplant. But Eddie's done two more, and they're the best, some of the best facial transplants that have been done. So it's still an experimental thing because they can't manage the immune reaction. And he
Right.
spent his career here trying to invent better ways to manage the immune reaction. And the problem is too much skin. You know, the kidney survives pretty well because there's no skin.
Yeah.
Once you have that much skin, you're doomed.
So the face survives, but the organs.
Other organs succumb to the immune reaction
Yeah.
because your transplant medications, you know. And currently, there are several people. The first transplant in France died. There's several others that have had renal failure, and now this is another one.
Did Dr. Lee do a double hand transplant
He
up
did.
here? Yes. How did that turn out?
You know, the function is limited, and they're going to have the same problems because of the large amount of skin. And so the enthusiasm has waned among most people. He's still enthusiastic about it, but the other thing is the Applied Physics Lab, which is a very famous laboratory here at Hopkins, has come up with really amazing prostheses. I mean, they're going to be designed so that you think something and the electric current goes down and does something in your hand. Now, how amazing is that?
Okay, good. I'm going to skip to my last question. Work
Yeah.
back. Is it where do you see plastic surgery in 25 years? Because this is a nice lead into that. But
We could have never predicted in 1976 when I walked across that doorway, we could have never predicted where we are now.
so you predict for 25
These
years.
were ideas that just didn't exist.
I know.
But, you know, the same thing will happen because plastic surgeons are some of the best innovators around. They think out of the box. You know, two people can't agree on anything. You know, if you built a fire in this room, we'd all leave by a different mechanism at a different time and be sure we were right. And that's what makes us good innovators, you know?
Well, I'd say you put 5 plastic surgeons in a room, you'll get 7 opinions.
Yeah, exactly. Yeah, with one changing all the time.
Yeah, right. So
But, you know,
so you think
take what I do, take facial fractures.
Okay.
You're going to be able to pin something through the skin, move it into position, and then in some way freeze it there. You know, whether it's injecting a glue in the fracture site or you don't have to fix every fracture site. You just, you know, we look at them to line them up.
Right.
But a little glue in one spot, there isn't a great deal of force. It's not like your femur, you know. So they're going to have great ways of making bone, replacing bone, fixing bone, rigid fixation, which was one of the hallmark therapies of fractures for orthopedics and plastic surgery and elective operations, is going to go away.
Who would you say now?
Disruptive innovation.
Okay. Interesting.
All the people who make plates and screws, you better get ready to have another job.
I was going to add on that when I was in residency, and I had a great residency up in Ohio.
Yeah.
And we did all the facial fractures.
Yeah.
And it was all wires. And boy, I could spin those wires. But
Yeah.
now, guys come in now, I said, how'd you wire the jaw?
They
We don't
can't
wire the
wire
jaw.
a jaw.
We put plates in. Seriously, you put these little plates in. So
Yeah, but you would take all little pieces and wire them back together, and you had chain link wiring, you had all these techniques.
the
Larry
approach
Sargent was the best guy at wires I have ever seen.
Larry.
Larry Sargent.
Okay.
He's probably the best craniofacial surgeon in the country right now for upper face. But he was as good as anybody has ever been.
What do you feel is your greatest professional accomplishment? And if you would touch on maybe your greatest, the failure of our society, what our greatest failure as a society is, or something, on both sides, if you would cover that.
Yeah, I've trained maybe 120 residents. I've trained.
How many chiefs came out of that?
I've trained 14% of the chiefs in this country.
Wow.
So it's a great program. It combined with the University of Maryland. Nelson Goldberg, who's a visionary, was in charge of the University of Maryland, and we talked and we said, why don't we have one great program instead of two average programs? Most cities have a bunch of average programs. Mm-hmm. So we have a great program, and it's simply because of the resources. We control all the emergency traffic, of any kind. Mm-hmm. And we can go anywhere we want to hospitals and capture the best material. So it's a great program, and with the right mentors, these people want to do what you do. And I've been very fortunate to be able to enjoy some of the best residents in the country. They're so smart that they end up inventing things all the time. Mm-hmm. And, pushing frontiers back, and it's a great experience. I think what I've enjoyed doing is taking what I learned in facial injuries and converting that into how to reconstruct cancer defects in the face. And we have it down. People like Burgett and Minnick revolutionized the management of soft tissue. And they really transformed it from something that we didn't know about to the fact that you can keep refining this result and observing certain principles like aesthetic units. Mm-hmm. It's just amazing what you can do.
One thing, this isn't about me, it's about you, but when you said about facial cancers, or that the nasal reconstruction has gone so far. I remember the articles back in the 70s, and they were really bad. And then I see some results now. I have a friend that had a total nasal reconstruction.
It's unbelievable.
It looks like his nose.
Yeah,
and the scar
exactly.
It's an ear.
The scar is the most noticeable. The forehead scar is the most noticeable feature of the reconstruction.
Right. So, and that's
so Minnick just wrote his third book. It's a 2-volume book. He couldn't get anybody to publish it because he said they're not going to make any money on it.
Yes.
So his friend write auto mechanics books. So he said, I'll publish it for you. So he published it. It's 2 volumes. It's beautiful. It's all color. It's his whole life experience. And the guy gets the books back, the auto mechanic publisher, and he said, I've never published a medical book. What do I do with this thing? Mm-hmm. He said, I don't have any idea how to market it. So he took him over to Fred's garage and put him in his garage. And now Fred is trying to sell it. But here's this unbelievable compendium of expert material.
Well, listen,
the publisher told him, people want to read, we'll publish a 100-page book. This is a 600-page book.
Yeah, well,
We'll publish a 100-page book.
The attention
Or why don't
span.
you do a 10-minute video? That's what they want to do. They want to watch a 10-minute video before doing a case.
Things are a little different. But you reminded me when I visited Dr. Edgerton,
Yeah.
and I don't know what his daughter, I can't remember her name.
Diane.
Diane. She took me up to the storeroom above the garage.
Which had
Thousands
everything
of
in it.
Slides.
Glass. Big glass slides.
Yeah, what happened to those?
As far as I know, they've still got them.
They can't get rid of them. Harvard will take them in their archives, but
You know, you
they
can't even store this stuff.
know.
Here they've stopped storing things, you know?
What a shame. I mean, that's art.
Well, it's wonderful, you know, and we're so lucky to have a few visionaries who try to keep it. The library at NYU is still great.
Well, I hope that I don't think that Diane would get rid of them, but when she took me up there and every single case, and you know how he was about recording every single thing.
Yeah, and they
You
had
went there, you
the
could spend a
photographer that recorded his cases. His name is Zuhair. He every time you admitted a patient to the hospital, he took a picture. And then, of course, Edgerton wanted more pictures. So every patient has a picture in the archives.
Interesting.
Yeah.
What do you think their greatest failure as a society has been? At
In plastic surgery?
Yeah. Our society, we could spend all day on that part, but in plastic surgery.
I think their educational program is poorly thought out. In that there's too much introductory material. There's obviously a limit on how long you can go to school or how long you can train. To me, you ought to start with the most important stuff, and then if you have time for all this other stuff, that would be okay. You don't. So why we have 3 years of general surgery and then all these rotations where you don't really learn anything, because the other specialties have changed. When you did general surgery, you actually did a bunch of operations. You didn't sit there and watch.
Mm-hmm.
That watching is of limited benefit to a surgeon. You know, you need to be doing something with somebody who's teaching you how to manage soft tissue. So to me, it ought to be totally changed. I think a lot of people who run the decisions of what to put where and how to organize things don't operate.
Yeah.
Sorry, but that's the truth.
Well, I teach some at it's actually an osteopathic school, but
Yeah.
they have all these the rubber body, the sim labs.
Yeah.
And it's like, and they got all their sets, and I thought, you just really got to get with a human. The
Yeah,
rubber,
yeah.
they're just not. But
And, you know, cadavers are okay, but, you know, there's nothing like the tension of really trying to do an operation.
Yes. Yeah. And I remember my first one as
Yeah.
a resident. There's a lot between, but I agree with you. What has been and I think you may have touched on this, your greatest joy? I just want to get through the questions here. And what you would give advice for future and present plastic surgeons?
You know, my greatest joy is learning from some of the smartest residents in the world. I tell them how to do something, and they do it slightly differently.
Mm-hmm.
And about 1 out of 3 times it's better than I do.
Yeah.
So I capture that. And they're all so smart, and just in trying to learn something, they make things better. So I could have never accomplished what I did without them trying to learn in front of me. And it's really an amazing process. They're so bright.
How many residents apply to your program a year?
Ooh, I think about maybe 100 or so.
And obviously that 100's the top of their
Yeah.
class,
Yeah.
if you will.
Yeah.
And how many do you take a year?
We take 3.
Okay. Well, you get a very select group.
Yeah,
don't you?
and we're very lucky.
Any advice for future plastic surgeons or present ones as far as where what your words of wisdom, I guess, is what.
I think our people are very much smarter than we were because the educational system improves all the time. I don't think they work as hard as we did. So they don't know the intricacies of care like you did. I mean, you took care of all your patients. You did their lab work. You did their physicals. You did everything for them. You mixed their IVs. You knew what it was like to be a patient.
Yeah. Bottom up.
There's no substitute for that.
Yeah.
Because you understand the patient. They've got a ton of caregivers between them and the patient, so they'll never get it as well as you did. Okay. And they just have to spend time. I teach my residents to make 2 diagnoses on everybody. One is what's wrong with them. You got a cancer at the end of your nose. The other is who they are. What do you do for a living? What's your family situation? What's the emotional composite of your personality? Because I think you have to know both things to take care of somebody really well.
I agree. The biggest problem is with...
And you do that automatically.
Yes.
And if you're going to do a cosmetic patient, you do that patient much more thoroughly than you do a nose basal cell.
We're going to finish up here today with Dr. Manson on thoughts about future plastic surgery. And we touched a little bit earlier, but any other ideas or any other things you'd like to say or talk about?
So I think it's like a baseball team. The future of plastic surgery is who you have on the team. It's just that simple. You don't pay attention to that, and you don't train them well, and you're not going to do well. There's tremendous competition among other specialties for the areas that we think are ours. Many people have an anatomical boundary. In other words, the ophthalmologists have the eye, and they get special training in the eye. So you haven't had special training in the eye, so you're less comfortable taking care of it than ophthalmologists. So if they decide to do oculoplastic surgery, they're going to take that over. Mm-hmm. If the GU people decide to do hypospadias, they're largely going to take that over. So the issue for us, I think, is we have no anatomical organ. We're all over the place. So the only way we can survive is quality and innovation. So as long as we can do that, we'll be okay. And when we stop doing that, we won't be around, is my philosophy.
Okay. Well, we shall see. Dr. Manson, it's been a privilege interviewing you. Thank you so much.